Diabetes Virtual Video Assignment Clinical Day 6. Diabetes is a disorder of impaired carbohydrate, protein, and lipid metabolism caused by a deficiency of insulin secretion. Lack of insulin can result from destruction of beta cells or be due to the body's tissues being inactive or resistant to the insulin. This video will focus on diabetes type 1 and have an emphasis on diabetes type 2 as it is more common in the generalized public. Type 1 diabetes, often called juvenile diabetes, accounts for 5% total and is nearly an absolute deficiency of insulin. Primary beta cells have been destroyed. These patients require insulin injections, or the fats in their body will be metabolized for energy, resulting in ketonemia or acidosis. It is an autoimmune disorder of decreased insulin production by the pancreas and increased glucose production by the liver. Type 2 diabetes is caused by a relative lack of insulin or resistance to the action of insulin. Usually insulin is sufficient to stabilize fat and protein metabolism, but not carbohydrate metabolism. Type 2 diabetes can generally be controlled by diet, exercise, and continual blood glucose monitoring throughout the day. Risk factors for diabetes mellitus or type 2 will be a family history of diabetes, obesity, which could be 20% over the ideal body weight, and hypertension of or greater to 140 over 90. Diabetes type 2 clinical manifestations include polyuria, polydipsia, polyphagia, fatigue, weakness, sudden vision changes, paresthesia of the hands and feet, dry skin, and slow healing wounds, as well as recurrent infections. Diagnostic criteria include symptoms for diabetes plus casual blood glucose concentration equal to or greater than 200. Fasting glucose greater than 116. Fasting is defined as no caloric intake for at least 8 hours. Actually, that glucose number needs to be higher than 126. As well as a 2-hour post-load glucose equal to or greater than 200 during an oral glucose tolerance test. This test should utilize the equivalent of 75 milligrams of anhydrous glucose dissolved in water, as well as an A1C of equal to or greater than 6.5%. Lifestyle modifications for diabetes mellitus include adding exercise, eating a diabetic or controlled carbohydrate diet, taking meticulous care of feet, monitoring blood glucose levels, and taking medications as prescribed. Diabetes mellitus oral medications include second-generation sulfonylureas, such as glipizide, biguanides, such as metformin, and alpha-glucosidase inhibitors, such as acarbose or amyclitol. Diabetes mellitus injectable medications include rapid-acting Lispro, otherwise known as Humalog, very long-acting insulin, known as Glargine or Lantus. Foot care for the diabetic includes inspecting their feet daily, washing their feet daily, wearing shoes and socks at all times, protecting their feet from hot and cold, and to keep the blood flowing in their feet, such as propping your feet up and wiggling your toes several times throughout the day. The diet for a diabetic should consider weight, activity level, medications, and other diagnoses such as cardiac or renal issues the patient may have. They should have a schedule for medications and eating that should be kept close to the normal times at each day. This helps to regulate their blood glucose levels more evenly. A diet high in fiber and low in saturated trans fats and cholesterol is also recommended to prevent coronary heart disease. Dietary intake should be individualized to each patient and the type of foods that they like to eat. Carbohydrates should make up 45 to 65% of a total daily intake. Complex carbohydrates are preferred as they help to keep glucose levels even throughout the day. where simple carbohydrates can cause spikes in blood glucose levels. Diabetic patients should be followed with a dietitian to ensure proper education and understanding, as a new diet can be hard for some individuals to understand and grasp. Complications include diabetic neuropathy, hypoglycemia, microvascular complications such as diabetic retinopathy, and macrovascular complications such as atherosclerosis. At the end of